Zapkowski, and today for our video we're going to be showing you some PNF techniques for rolling. My part of the video, I'm going to be demonstrating the mass flexion and the mass elongation technique. This technique is for patients who might not be able to be strong enough to initiate the other steps in the rolling. It's achieved in the sideline position, so they might not be strong enough to go from supine or from prone. So they start in this position. It's a little bit easier for them. It involves the scapula and the pelvis movements. So the name mass flexion and mass elongation talks about the core and the trunk. So for the flexion technique, it's going to be flexing the trunk, which is making, or in other words, making it smaller. And then the elongation is doing just that, so it's going to make the trunk longer. First, we're going to do the flexion technique. And the movements that we're going to want at the scapula and the pelvis is for the scapula, they're going to be going in this direction, so anterior depression of the scapula, and then for the pelvis, it's going to be anterior elevation of the scapula. So to begin this movement, like I said, the patient's in a relaxed position in sideline. We don't have a table that we can use here, so body mechanics are going to be a little off, but just be aware of that when you do it during treatment. So I know the book showed this differently, but I like having the patient's elbow bent, so it gives a little bit more control that I can move. And then the pelvis is here. So since we're in two different planes of motion, so anterior depression, anterior elevation, it's two different diagonals. So I can't be in both different planes of motion at once. So if that can't be achieved, you got to have your forearms in the plane of motion. So my forearm is in line with that. My forearm is in line with that. And then to start off, we're going to do some rhythmic initiation. So we start off passively. So just let me move you, relax. Good, just like that. Good. Again, as you can tell, this trunk gets shorter. So we're flexing. All right. Now, you can help me move you a little bit with the core. All right, good. 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 All right, can you do that yourself? Mm-hmm. All right, do that for me. Good. All right, now just relax. So we went through already passive, active assistive, and active range of motion. Now we're going to be providing a little bit of resistance. All right, so let me just relax for a second. So we're going to move them back a little bit, and then, again, both forearms are in the diagonals. Aiden, just push against my hands, okay? All right, so we're going to instruct the patient to push against your hands, and then do that. Go ahead. Good, we're providing some resistance. Now relax and move it back. Good. Push against my hands. Good. And then one more time. Push against my hands. Good. All right, now relax. All right, so that's a little bit easier of a variation because their arms and their legs are more closer to their body. If we want to make it more difficult or the patient's progressing better, a way of doing this is moving the arm and the leg further away from the body. It challenges the patient a little bit more, challenges their core, challenges their balance. So for this technique, I'm going to walk the patient through it first, make sure he knows the motion, what we're doing. All right, Aiden, so you're going to think about touching your elbow to your knee. All right, so touching elbow to your knee, and then you're going to straighten your arm and your leg. Just like that. Good, perfect. All right, go back. One more time. All right, now that the patient, go back one more time. All right, relax. Now that the patient is familiar with the motion, what we can do is we can provide a little bit of resistance. So for this, my arm, once the patient is extended in his arm and his leg, my hands are going to be on the inside of his elbow, the outside of his elbow and the outside of his leg. So he's going to be providing force in towards a flexion motion of his core, and that's how the resistance can be applied. All right, Aiden, so go back, touch your elbow to your knee, and then extend. Good. All right, so my hands go here, and then push into my hands. Good. Go back, push into my hands. Good. And then that is the mass flexion portion. Alright, so now I'll be showing you how to do the mass elongation PNF technique. We just went over the mass flexion technique. The patient's comfortable with doing it, comfortable with performing that the movement. Now we're going to get into the elongation. So go ahead and get into the flex position, Aiden. Alright, good. As you can see here, his trunk is flexed, it's shortened. For the elongation, we're going to make it long, so we're elongate it, hence the name. So for hand placement, what we're going to be doing is our one hand is going to be on the upper border of the scapula, other hand is going to be on the ischial tuberosity, and again the forearms in the diagonal. So this might not be a good position or the best position for some clinicians because you don't have that much room to work with the diagonals, keeping your forearms in the diagonals, but you should just try to make it work the best way that you can. So again, you're here and here, and we're going to add a little bit of resistance. So Aiden, go ahead and push into my hands. Good, and then hold there for a second. And you can see how his core is nice and long, it's elongated. Alright, so you can go ahead and then move the patient back in the original position, and then have him do that again. Push into my hands. Good, go back. Push into my hands. Good, go back. Alright, you can relax. Alright, so now that we've done that a few times, added some resistance, patient's more familiar with that movement, we can go ahead and add in some isotonic reversals to make the patient work a little bit more. So you can go back into the flex position. Good. Alright, so again, hand placement, making sure your forearms in the diagonals. So go ahead and push into my hands. Push, push, push. Good. And then you switch your hands. So hands go here, push into my hands. Good. So we're doing both movements. Push in my hands. Push in my hands. Push in my hands. Push in my hands. Good. Alright, you can relax. Alright, so that's the isotonic reversals, mainly focusing on the scapula and the pelvis. Again, in this motion for the elongation, the scapula is going to be going posterior elevating, and the pelvis is going to be posterior depressing. So, getting that elongation motion. Once the patient's more familiar with this, once the patient is starts to be more comfortable with this exercise, we can go ahead and make it a little bit harder by getting the upper extremity and the lower extremity a little bit more involved. So, hey, remember the position with the knee to the elbow from before? Alright, so go ahead and get in that position for me. Good. Alright, my next elbow. Good. So for this position, what we're going to be doing is we're going to be placing our hand on the anterior part of the arm by the elbow, and then the posterior part of the leg by the knee. And then go ahead and extend your arm and your leg, pushing into my hand. Good. And then once they're in that position, we're going to switch our hands back to the position that we had them during mass flexion. So go ahead and push in my hands. Good. And then switch them again. Push in my hands. Push in my hands. Push in my hands. Alright, relax. Good job. Alright. So that's more of a isotonic reversal with upper and lower extremity involvement. And this concludes the part on mass flexion and mass elongation.
Okay. Hey guys, so today I'm going to be furthering what Colin was talking about, and we're going to continue teaching you ways to roll and different patterns for that. And so today, first we're going to be showing you how to roll from supine to side lying on your elbow. And then we're going to move from side lying on elbow to prone on your elbows. And then I'm going to be showing you how to use your lower extremities to roll as well. Okay, so let's get going. So first, we're going to be doing supine to side lying on elbows. So you're going to have your patient, so first we're going to show you assisted. So first you're going to have your patient have the lowermost extremity positioned 90 degrees, and then you're going to instruct them to lift with their head and turn their head towards the direction they're rolling, and then lift with their chest, and then their other extremity is going to be used to kind of reach for the direction they're rolling. So while I'm assisting him, I'm going to have my hands in the axillary area, and he's going to have his other extremity on my shoulder, and he's going to use that to help pull himself up onto his elbow. So, get down here. So bear with me here. I'm on the floor, so it's not the best form here, but yeah. So, okay. So 1, 2, 3. Good. So you have them bring their hand down, support themselves. So that's how we get to that position. And then, so you bring them back down. So once they get a little bit better with this, they can start to do it on their own. So you can just use cues and tell them to reach with the other extremity. Lift with their head and chest. And 1, 2, 3, go. Good. So once they're in this position, you can kind of come behind them and do rhythmic reversals on them. So you're going to be placing your one hand on the anterior superior scapula, and then your other hand on the inferior posterior scapula. And you're going to have them move into the resistance. So good, 1, 2, stop. Good, and go. Good. So this kind of shows and stimulates the movement of rolling. Okay. So once they're in this position, we can kind of help to assist them to get into prone on their elbows. So what I'm going to do is stand over him, and I'm going to be in here again. And when I'm in here, I'm going to be helping him to rotate his upper extremity into the prone position. He's going to be moving his legs over, and yeah. So I'm going to help lift and move it over. And help move over to the prone position. You get there? Good. Okay. So now that we know how to move into that position, you can have you flip back over onto your back. You can get your legs involved. So this is going to be a little bit difficult for me to stay in the diagonal because we don't have enough room for that, but I'm going to scoot this over a little bit to kind of see the legs. Okay. And so for this, what we're going to have your patient do is they're going to be flexing the uppermost extremity. So if he's rolling this direction, it's going to be his left leg here. So it's going to be flexing at the hip and knee up to here. And then he's going to be adducting across his body and externally rotating the hip and moving into that position. So just like that. So you can have him do that. So bring your knee up. Good. And rotate. Good. Like that. So that way he's using his lower extremities. He can kind of help with that upper extremity movement as well of reaching across his body to get into that side lying position. So go ahead and come back for me. I'm going to come on this side of him. And once he gets towards the end position, I'm going to provide like an isometric hold at his pelvis and distal femur. So go ahead and move through the motion. Good. Okay, and then so bring it a little bit there. All right, so hold here. Good. Relax. Okay, and hold here. Good. You roll back. Like that. So when he is moving back, he'll be moving into extension and abduction and internal rotate or external rotation or internal rotation. Yeah, so that's how different patterns for rolling.